Interstitial cystitis is a term used to refer to chronic pain or irritation of the bladder. However, most patients also have symptoms involving the other pelvic organs. For this reason, this disease is more commonly called chronic pelvic pain or even painful bladder syndrome. Interstitial cystitis affects women more than men at a ratio of 9-to-1. In fact, it affects approximately 6.5% of all women in the United States. These women are 2 times more likely to have had a history of recurrent urinary tract infections. The median age of onset is around 40 years old. We think interstitial cystitis starts with trauma to the bladder that causes local inflammation and pain. There's a subsequent release of inflammatory proteins which causes this heightened inflammatory response, sending an upregulated pain response to the central nervous system. We don't know what causes it, but there are several theories. One is that this is an autoimmune disease. We think this because a lot of people that have interstitial cystitis have other inflammatory conditions like fibromyalgia, irritable bowel syndrome, or even lupus. Some newer theories are that this is a dysregulation of the body's perception and ability to deal with pain. Treatment options for interstitial cystitis are different for each patient based on the type of symptoms that they have. We encourage all patients to make some behavioral changes to try to reduce their symptoms. This may include diet, may also include therapies like pelvic floor, physical therapy, or just recognizing what triggers their symptoms. We often use medications to treat this disease, but the type of medication can be targeted to reduce pain, to reduce symptoms of an overactive bladder, and also to reduce local inflammation. There are several procedures offered to patients with interstitial cystitis based on their symptoms. 2 of the most common are bladder installations and hydrodistension. A bladder installation is where a catheter is placed within the bladder and a local numbing medicine is used to try to soothe the bladder and reduce your pain. Hydrodistension is where we gently distend the bladder to its capacity with the idea that we're helping to numb some of the reactivity of the nerves within the lining of your bladder. Unfortunately, we consider interstitial cystitis to be a chronic disease, which means it's not curable. However, I like to use the term remission, meaning once we identify interstitial cystitis to be the correct diagnosis, we can implement a treatment plan so that patients have minimal symptoms for a long period of time. Often, the most difficult time for patients is when they first receive a diagnosis of interstitial cystitis. The reason for this is that it can take on average 20 to 50 months before they receive the correct diagnosis. Once we make this happen, we can quickly implement a treatment plan to help them feel better.